My name is Tore Kvien. I'm a rheumatologist in Oslo, Norway, professor at the University of Oslo and head of Department of Rheumatology at Biakonhjemmet Hospital in Oslo, Norway. So regarding the impact on the market of the first monoclonal antibody biosimilar in Europe, I expect it will be huge. The main reason is that biological DMARDs, as we call it in rheumatology, or TNF inhibitors and similar drugs, they are very expensive, and we know that there are huge differences across Europe regarding the uptake, and we also know that countries with poor economy, lower gross domestic products, for example, they have less access and more restrictions for these drugs. So by lowering the price, I really hope that also more patients in Europe will be able to use these drugs. First of all, I think education will be very important, both for all stakeholders, for the doctors, for the nurses, but also for the patients, so that they have the real understanding that the biosimilars, they are really similar to the originator products regarding efficacy, safety, and immunogenicity. Interchangeability, whether it will be safe to change patients on stable treatment with Remicade to Remsima. And I think that before that will be really implemented into clinical practice, we need to see more data on switching from originator to biosimilar, both studying efficacy, safety, and immunogenicity. And this is also now what we are trying to do in a government finance study in Norway called the NorSwitch study, where patients on stable treatment with Remicade, they are, if they consent to go into the trial, they are then randomized to continued treatment with Remicade or switching to Remsima and followed for 1 year.